Hi, everyone. Thank you so much for joining us today for the UCLA Global Internship Program. I'm here as your Associate Director for the Global Internship Program at UCLA, and we're here to discuss our global health programs in La Paz and Oaxaca. I have a colleague from CFHI, which I'll have her introduce herself as well.
Hi, all. I'm Carolina Bolaños. I'm Director of Programs for CFHI. So nice to be here with you guys.
So today, Carolina and I are going to talk a little bit more specifically about the program in terms of just some of the logistics, the overall things you can expect while you're on the program, the academics, what you might expect in terms of your observational rotations, also the focus of CFHI in terms of how they approach global health. We'll have some time at the end as well to discuss finances and a Q&A. So if you have any questions, you can feel free to put those in the chat, but we'll probably get to those as a group at the end. And we're just excited to have you all here and discuss more about the program. So I spoke a little bit about our agenda already. So right now, I'm going to talk specifically about the La Paz and Oaxaca programs for global health. So for the global health track, we have two specific locations, La Paz, Bolivia, and Oaxaca, Mexico. Within these programs, they have different sectors where you could be doing observational clinical rotations, which could include child health, hospital medicine, indigenous health, maternal and reproductive health, pediatrics, primary health care, and public health. And when Carolina is back on a little bit later in the presentation, she'll talk a little bit more specifically about what you might be doing in those observational clinical rotations, what you might expect. This just gives you a general idea of the types of rotation sectors that are available. This program is open to all UCLA majors and minors, so you don't need to be a specific global health minor, for instance, to participate in the program. We have a lot of biology majors, public health majors that participate, so it's open to other students. And just note that not all of these rotation sectors are going to be available in each location. So again, a little bit later, we'll talk about what to expect in La Paz and how that might differ from what to expect in Oaxaca. Program at a glance. So this program will occur during summer session A10. It includes 8 weeks of your clinical observational rotations, so June 22nd through August 17th. And it also includes online coursework that will go for 10 weeks, so June 24th through August 30th. The coursework will include one mandatory course, we'll talk about in a second, and one optional course. So you have between 4 and 8 units you'll be taking during the program. And if you are interested in receiving financial aid, you must be taking both courses for 8 units to be eligible. These observational clinical rotations are academic, so they are unpaid, and you will be participating in about 32 hours of program activities per week. So these activities are going to be made up of your clinical observational rotations. You will also have a few days a week of Spanish language classes. These are not for UCLA credit, but are more focused on medical Spanish that could hopefully assist you at your clinical observational rotations. And also weekly lectures from the medical directors that are on site. So that will really assist you in learning more about the health systems in the location that you're currently living, and learning more also about some of the determinants of health, some of the challenges maybe they might face in those locations, learning more about the styles they might focus on providing healthcare. So a lot of great opportunities to learn from your medical director. For this program, again, open to all majors and minors. You must have an intermediate level of Spanish in order to participate. So what does that mean? So oftentimes we might have students who are fluent in Spanish or are heritage speakers. Most likely you already will have an intermediate level of Spanish upon applying. If you are a language learner, we suggest that you complete Spanish level 3 or the equivalent to that course. So whether you did that AP coursework or transfer units from a different community college, in order to participate. So if you are able to finish Spanish level 3 by the time the program goes, then you should be good in terms of being at intermediate level Spanish. That said, I would highly encourage all students who are really, language learners and trying to improve their Spanish language skills to do as much Spanish as possible, take as many courses as possible before you attend the program, because you will be staying at homestay with homestay families. Everything during the program will be completed in Spanish. So your proctors during the clinical rotations will be speaking with you in Spanish, as well as the medical directors during their lectures. So it really only assists you more to have, more Spanish language skills. But of course, during the program, you're going to continually learn as you're there. So it's going to, be an opportunity to improve your Spanish language skills while you're abroad. 3.0 GPA, if you're a transfer student and you don't have a current UCLA GPA, that's fine as long as you have a 3.0 after we do the grade check at the start of winter quarter. So meaning you get 3.0 on your coursework in the fall, that will mean that you are eligible. And then 90 units completed by spring 2024, so this upcoming spring. That can include transfer and AP units. So if you're a transfer student, again, that can include those transfer credits, or if you have a lot of AP units you transferred in from high school, and then good academic standing. The coursework that's provided during the program, we have the mandatory course, which is International Area Studies 195 CE. This is your internship course, and you will have a final paper that focuses on topics within global health. You also have some weekly writings you'll have to complete. It's asynchronous. You'll have a TA on campus that you'll be working with. This course may fulfill electives for the minor for global health by petition to your program chair. And for public health majors, you will earn upper division units toward your school's 60-unit upper division requirement. And you can also petition credit towards the major's community engagement requirement. Additionally, there is CESC 130, which is Intercultural Communication in the Global Workplace. This course also is asynchronous. It's a little bit more structured, though, where you do have lectures that you will watch that are pre-recorded. You will work in some work groups with other students on different international programs with the Global Internship Program. This course provides you enough units to receive financial aid. There is no automatic credit in terms of transferring for a specific major or minor requirement. However, as a normal UCLA course, you will get upper division units, and you're always free to petition for a particular GE requirement through your school, but we don't have any specific credits currently with global health or public health that are already approved in terms of a major elective or GE. The application is currently open. It will close on November 27th. You can apply anytime during that window. Your application is treated equally. I do encourage students, though, to apply as early as possible if you are interested in the program. There's no financial commitment until you are officially accepted into the program, which occurs in the middle of January. And the second step in the application process is a advising interview with CFHI. So again, our program partners, both in La Paz and Oaxaca. And CFHI will conduct the advising interview with you at any point after you submit your application. So 95% of students will decide to submit their application usually during that last week. And that means that we have to fit all of those advising appointments in the month of December, which could, conflict with maybe your 10th week, finals week, or your vacation plans. So we always encourage students to apply early, because if you know that you're interested in the program, you can complete that advising session as soon as possible. Please note that advising session will be done partly in Spanish, and that will be done in order to gauge your Spanish language level. So just be prepared that part of that session will be completed in Spanish. And now, without further ado, I'm going to throw it over to Carolina and have her talk a little bit more about CFHI.
Thank you so much, Andrew. And I see some questions in the chat. Do you prefer to stop now and answer them, or should we wait till the end?
I can answer this now because we just talked about Spanish. So this question is, do we have to have completed Spanish 3 when we apply, or just prior to the program starting? So technically just prior to the program starting, so by spring 2024. If you know you're interested in the program, though, and you are interested in taking more Spanish coursework, I, of course, would encourage you to complete Spanish 3 in advance, like in winter quarter, or if you're enrolled in fall, so you can take another Spanish language course, in the spring. But technically only by the spring quarter is it required. And then the second question, which we answered, I think, before I saw your question in the chat, yes, part of the advising interview will be completed in Spanish. So it will be about half and half. And so that's when they will gauge your Spanish language skills. So if you are planning on completing Spanish coursework later on in the academic year prior to going on the program, you'll still want to kind of prep yourself a little bit, before you submit your application if you are a little bit nervous about the Spanish part of the interview. That said, we still highly encourage you to apply. So, the program, again, is another way to improve your Spanish language skills while you're there. We just want to make sure that you have a good baseline before you do go abroad, because it is quite intensive. You are at homestay families who won't be speaking English, and you are in an environment in the hospital setting and clinical setting where also they will be speaking strictly in Spanish. So want to make sure we set you up for success before you go.
Great. Thank you so much, Andrew. So, well, my part of presentation, I want to give you an overview of CFHI, what we do as an organization, how the organization is set up, and then we're going to go into specifics about each program and tell you a little bit more how your day would look like if you're in the program, right? So, next slide, thanks. So just to start, CFHI is a nonprofit organization. We've been working in the field of global health education for over 30 years. We have different opportunities available for students, like internships, electives, practicums, and so on. And we partner with universities like UCLA to also put together this custom programs. Next slide. So we have programs in 10 countries. We have over 25 programs. We have a really vast alumni community that is that engages often with the organization and in different projects. So if any of you are interested in learning more about this and want to be connected with someone that completed a similar program or one of these programs, just let us know. Next slide. So what makes us unique is not only what we do, but also how we do it. So we're recognized by United Nations. We are recognized also by our approach to equity, diversity, inclusion, and how we prioritize ethical engagement and best practices in our programs. So CFHI not only implements these principles in the programs, but is also a thought leader in the field of global health education. Together with other partner institutions, we're looking to put forward the best face to global health education, because we know like there's a big opportunity for this type of experiences to be developed in a way that are not a win-win relationship when students travel abroad. So part of our work at CFHI is not only, like I said, creating our programs aligned with this best practice, but also contributing to the field of global health education. Next slide. So what we do, or how we set up the programs. So each rotation is designed to emphasize existing health systems and existing resources. While you're in country, it doesn't matter if you choose La Paz or Oaxaca, you're gonna be embedded within clinics, hospitals, different settings that are part of the national healthcare system. It's not something that is put in parallel that could somehow undermine local efforts. It's not like a side project for students to go in. It's more you getting that first look, that first road look at how the health system is shaped, how health is perceived, and how health and disease processes happen in this new location. We've partnered with different institutions in country, like primary health clinics and hospitals and different NGOs to put together this education experiences. In this relationship, right, of people from high-income countries traveling to low-income countries, really easy to get lost or I feel no, we do need to acknowledge that there's a power imbalance when we travel abroad, and can be accentuated at how these programs are set up and the role of the student and the role of the host institution or host facility. So we definitely want to make sure that we're setting you up for success, you and all of the ecosystem around you when you're in country, and you're coming as a learner to this space and learning from the local health professionals. We practice virtual learning partnership principles. This is a way for us to be accountable of the outcomes and values that we want CFHI to reflect. This is a rubric that evaluates things like how leadership is organized, how experiences are set up, how fees are distributed, and I can go on about this. And there's more information on the website if you're interested in learning what fair trade means in the global health education world. And we focus on asset-based approach. This is a concept that you're gonna keep hearing about it during your pre-departure training, because we want students to be set up with a lens of coming through. Let's learn about all the good things and amazing things that are happening in La Paz and Oaxaca. What are some of those innovations that have been incorporated in the health system, how they're facing some challenges, but are overcoming those challenges, right? So all of these concepts that shape your experience, I say like it's part of CFHI's DNA, you're gonna be introduced during your pre-departure training, continue to learn and advance in best practices. Next slide. So what to expect at the clinical rotations? You're gonna be taking part of engaged observation. That means that you're not gonna be treating, diagnosing, or being direct, have direct responsibility for patient care. This, again, aligned with our commitment to ethical engagement. You're not gonna be participating in invasive procedures, but you're gonna be observing and shadowing the professionals doing these procedures. And this is very important because it sets the expectations about what the type of things that we want you actually to learn from the program, that it's not clinical skills. And if we go to the next slide, we want to focus more on the competencies in global health. And this is aligned with the graph that you're seeing is coming out of our research by UCAD, thinking about what are some of the weaknesses of domestic health professionals when moving to global health field. And as you can see there some of those pillars that are incorporated in the global health competencies, like understanding the context, realities of global health, flexibility, adaptability, creativity, cultural sensitivity, cross-cultural communication, and knowledge, key players, system, process, right? So again, our programs, the learning outcomes of our programs are aligned with helping you get this competencies that you're going to be able to implement later in your professional and personal life. Next slide. So this, we can go to the next slide, it's fine, thanks. So if, like I mentioned before, if you want to learn more about this, there's a tab in our website under publications, and you're going to see many of these have been co-authored by our global medical director and our global team. And this is an ongoing process for us as an organization. Next slide. So how we want students or to perceive this experience, right? We want to really shift the assumptions that it might come up when doing international rotations, right? We want to go from certainty that I know how a health system works to more curiosity. Let's learn about this new health system in another part of the world. Instead of coming as a fixer, trying to engage in initiatives like trying to find solutions to some of the current issues, we want you to come in with the learner hat and just trying to be curious about different challenges, but also opportunities happening in country. Just humility, understanding, and appreciating the complexity behind global health realities. And I like the last one, from critics to admirer, because I do feel like that shapes a lot of how you interact with different stakeholders while you're in country as well. Next slide. So like I mentioned, we have sites in 10 different countries, and we're going to focus, if we go to the next slide, in La Paz and Oaxaca. In each site, we have the same structure of how the team looks like in ground. We have a local medical director and local coordinators. The medical director is the one that is going to oversee clinical rotations and support an incident response. The local coordinator is going to be more logistics, transportation, lodging, all those things, and a cultural advisor for you. And the preceptors are the professionals that you're shadowing on a daily basis. Next slide. This is our team, and you're going to get to know them before departure as well. Gonzalo and Doctora Cecilia are in La Paz. Doctora Marta, Sandra, and Doctora Magali are our team in Oaxaca. Next slide. So I'll start south. I'll start in La Paz. La Paz is have any of you been to Bolivia before? Can I get an emoji if you have been there? No, not yet. Okay. So La Paz is a really interesting city. Very, it's known for the altitude. A lot of people get a little bit of altitude sickness the first days, but it's just you'll definitely get used to it after a couple of days of being there. Um, it has the largest portion of indigenous people in Latin America. Bolivia, and that makes Bolivia a really interesting case study of how traditional medicine has been embedded in the health system and how both knowledge systems are working together and are being implemented. So if you're interested in traditional medicine, La Paz is a great place for you to further your knowledge around this. Um, La Paz, it's very known also for the transportation system and the teleférico that you see there in the pictures. I usually some of the things that got the students' attention because you're going to use them to go to a few clinical rotations. It's a really, there's a lot of hills, but easy to walk if you like walking uphill. I always say that because it is a tough walk sometimes, some of those big hills. And I'm going to talk about clinical rotations later, so I'm not going to discuss this right now. And for the US citizens, if you're traveling with a US passport, you need to get a visa upon arrival, but TFHI provides all the instructions on how to navigate that. Next slide. Then in Oaxaca, La Paz is a big city. Oaxaca is a smaller city. There's a historic center that is very walkable, like the city center is very walkable. And contrary to La Paz, very flat. You have a lot of restaurants. It's a really vibrant city. It's right now they're celebrating, well, this week they celebrated Dia de los Muertos, and it's one of those famous spots to enjoy the festivity because of how the livelihood and like the music and just the environment around Oaxaca. And there's recognized indigenous languages as official, and yeah, during this program, you're going to be focused on Spanish, but for any of you that are completely bilingual, you're going to have the opportunity to maybe incorporate a few classes of Zapotec if that is of your interest. For Mexico, you do not need a visa if you're traveling with a US passport. Next slide. So La Paz and Oaxaca share a lot of similarities in terms of the rotation sites. So La Paz, the main focus are gonna be public health, primary healthcare, hospital medicine, maternal health, pediatrics, and child health. This is because the rotations are in places that are more specialized in these themes. The pediatric hospital, maternal health department, right? And the public health part, if any of you is more interested in that side of global health, there's different NGOs that we work with that we can organize rotations there as well. Then in Oaxaca, you're also going to get to see different tiers of service within the health system, primary healthcare, but also the hospital medicine. Most of the rotations are going to be either in different primary care settings, clinics that are across the city, some really close to where you are, some a little bit further out where you are in Oaxaca City, and in Hospital Civil, that is a secondary level hospital that has different departments and so on. What we say to students during the application process is that if you have a specific interest in mind, there's an area in your application where you can communicate this to the CFHI, and they do their best to try to accommodate this. Of course, this depends of the the local reality at the time you travel and many other things. And we also encourage students that while you're in country to be really feel empowered to talk to your local medical director if there's any rotation that you would like to experience, either because you're curious about it or because that is something that you're potentially thinking about pursuing later on in your career. Next slide. So what to expect, and this is the same for both programs, we have a really robust pre-departure training that includes several modules with information specific about your site, but just overall into some of the key concepts of patient safety, what's global health, ethics, and so on. We're going to organize also a pre-departure health and safety orientation, and the local team and CFHI Center leadership, it's always available to answer your questions. We coordinate airport pickup, and the second day you arrive on a Saturday. On Sunday, there's an orientation where the team goes over all the recommendations around how to get around the city, how to some do's and don'ts around your homestay family, schedule, rotations, all you need to know for Monday that you will start your rotations. Both programs, you stay with homestay families. This is intentional to support the cultural immersion portion of the program. And if you're learning Spanish, this is the best way to actually like improve your language skills, because it's informal conversation that is going to support the other more formal conversations that you're having in your clinics and hospitals. There's 2 meals included that you have with your homestay. You can expect around 5 to 6 hours of health-focused activities, 4 days a week, and lectures from the medical director at least once a week. Language classes are usually in the afternoon, and you're divided according to your language skill level. And CFHI is also known and takes priority on health and safety of the students, but also the host community. So you're going to have 24/7 support.
And I was just going to reiterate with the language classes. So those are non-UCLA classes, but they're really just to kind of, support you while you're there, assist you in the cultural immersion, and also assist you specifically in the clinicals, so that there might be, medical Spanish. Also some of, the words in terms of the slang might be very unique and different, in the locations that you are in, than what you're used to speaking in Spanish here, maybe in Los Angeles. So, just note that it's there to be a good, addition to support you while you're on the program.
Thanks. For your program, what you can expect, you'll have breakfast at your homestay, you go out to do your site rotations, you have lunch at your homestay, then in the afternoon, the language classes and the seminar, as I say, with the medical director, and the weekends are free time for you to advance in your schoolwork, but also explore the city and the locations where you're at. Next slide. And I don't want to go too much into it, especially because I want to be mindful of time. But during your pre-departure training, we're also going to go over all the different resources and support channels that you have from CFHI. And I mentioned this not only because I probably you're also worried about it, but we find it very common that parents or guardians tend to ask a lot of questions around this when students say that they want to travel abroad. So I just want to touch on the really strong safety net that you're going to have while you're participating, like I said, locally, but also from the central leadership team as well. Next slide. And I just want to, well, these are all the social media handles if you want to explore more about CFHI. And I don't know if you noticed in my presentation, there's tagline, let the world change you. And I feel like that speaks a lot of what CFHI is and what we want people that engage with the programs to get out of it. So I'm going to stay here until the end of the presentation for questions. But yes, this is a quick overview about CFHI.
And I just have a few more minutes to present. I know we're about at time, but I want to talk a little bit about funding options, just so you're aware about how to support yourself on the program. So just note that these programs are eligible for financial aid. So again, you'd want to be enrolled in both courses if you're planning to apply for aid, and complete your 24-25 FAFSA or DREAM application by the priority deadline, which should be March 1st or 2nd, I believe. There's some additional financial aid forms and documents you fill out once you're accepted into the program, but in terms of, just setting yourself up for success and applying for financial aid, you would just make sure that you're completing your FAFSA on time to begin with and enrolling in both courses. As far as the aid that's provided, aid does provide assistance for the overall cost of the program, and I'll show you a cost breakdown on the next slide. So that considers both build costs that are on your Bruin bill, as well as estimated costs such as flight, meals, things like that. But because it's the summertime and there's less grant funding available, that's true of all summer coursework at UCLA and programs. There's no Cal Grant available, and you are going to be in this program a part-time student because you're doing both an internship and taking 2 courses. We have a lot of scholarships available to help support you during the program. So in terms of scholarships, there's the Global Internship Program Scholarship, which is just for students that are participating in Global Internship Programs, so a smaller pool, great opportunity. The CCE Scholarship, which is the Center for Community Engagement, provides scholarships for those students who are completing an internship during the summer. The Kramer and Siebert Scholarship, I meant to take off the global affairs part on this. This is eligible for anyone who's on this program because your international area studies coursework applies to this particular scholarship, so you'd be eligible. And the Wang Middle Income Scholarship for $2,000. Additionally, Pell Grant recipients, you should definitely apply for the Benjamin and Gilman Scholarship. It's for $5,000. It's a national scholarship, but students nationwide, about 25% who apply receive it. And UCLA recently received notification that we were one of the highest receiving institutions, or highest achieving institutions of students receiving the Gilman Award. So I don't know the exact percentage, but I know every year we have multiple Global Internship Program students who do receive this award to support their studies. As far as the estimated costs on the program, a lot of the cost differences is really going to break down in terms of the cost of living when you're on site, as well as the round trip airfare, and really your own spending habits. So in the terms of La Paz, going to Bolivia, if you're a US passport holder, there will be a visa process that will be assisted by CFHI. They'll provide you all the information of how to get those documents. Nothing to worry about until you're officially in the program. For US citizens going to Mexico, there's no visa required. Obviously, a little bit shorter flight from LA, so your round trip airfare is going to be a little bit more affordable. Also, your eating habits will really affect, how, how much money you spend on meals. If you're eating out a lot, if you're eating the meals at your host stay families. Sometimes I like to note, even though there's 2 meals provided per day, the custom meals, let's say for breakfast, might be smaller than what you're traditionally used to in the United States. So just note that you may also want to supplement some of those meals depending on your own, habits of eating breakfast or lunch, things like that. But yeah, I just want to let you know there are scholarships and financial aid available to help assist with the program. And the program, you will obviously have a UCLA cohort. You'll have other students who are also participating during the summer as well with you, doing clinical rotations. You'll get to meet through this CFHI network, as well as meeting, locals through your preceptors while you're there. So it's a lot of fun. These are some of our students last summer that were in Bolivia and La Paz. And if you're interested in meeting our student ambassadors, we do have one ambassador specifically that was in La Paz last year, Kindersley, so you can always reach out to her. Or if you're interested in Oaxaca, reach out to us still, and we can connect you with students who've gone to Oaxaca in the past as well through CFHI. And as we open it up to questions, I'm just going to play this quick little video so you can kind of see what some of the students, specifically in La Paz, did this last summer. But I am going to open up to any questions that students might have, and hope that I can answer those as we finish up the presentation. So the first question in the chat, and you can continue to put these in the chat, or you can unmute yourself, but I'll go through the chat first, is a question about acceptance rate. As far as each of the programs, they are competitive because there's only a limited number of students we are able to take in each location. I would say don't worry about one location being more competitive than the other. I would select the location that you're interested in terms of the type of observational rotations you're going to be participating in, because there is, as Carolina was saying, some slight differences in terms of the types of clinics and hospitals, the focus of what they're going to be. Our goal is really to set you up for success. So in terms of, I know the language requirement, we don't obviously want to make that a hindrance for students, but it is really important to make sure that you have those language skills before you do go. In terms of finding the best fit and matches, really focus on that statement of purpose that you're writing in your application, and really talking more about your career goals, what you see for your future in terms of post program, any sort of skills or experiences you've already had that make you a good candidate. So just thinking through that. And then during your advising call, you all get to explain further about yourself. So I know that that statement of purpose is pretty short, but Juliana is going to be the one who's going to be taking those advising calls from CFHI, and Juliana will be asking more questions about you and learning more about you during that process. Is the application for both La Paz and Oaxaca the same, or is there different applications for each? So there is a different application for each program. You can only apply to one program at a time, so you can't apply to both. That said, if you do apply early and you're in that call with CFHI, your advising interview, which could happen as soon as you apply, so within like the next week or so, and you are talking with Juliana, and it makes it, if she mentions like, oh, like La Paz might be a better option for you, even though you're interested in Oaxaca, you can still change your application up until the November 27th date. So just note that after November 27th, whatever your application is set as, that will be what we will be considering you for in terms of the pool, whether it's for La Paz or Oaxaca. But that's the benefit of doing that advising call early, is that you could have the opportunity to switch your application prior to committing to one or the other. The next question is, can other courses offered by UCLA in the same session fulfill the 8-unit requirement for financial aid, or is CSC the only option? So the way that financial aid works is they only offer funding for one program during the summer. And so global internships is considered a program, and normal summer session courses are considered a separate program. So unfortunately, you cannot take a different UCLA course during the summer and have it considered as part of your financial aid package for the global internship program. You'd have to choose. I also will note that the courses that are provided by the global internship program are really set up to help support you on the program and add to your experience there. And so taking a different course can be really challenging just in terms of your timing. You're doing quite a lot of activities, the clinical rotations, your medical lectures, as well as your UCLA coursework, and the coursework. Your TAs and faculty that are on these two courses that we offer understand that you're on this particular program, but it can be really challenging to take a separate UCLA course because they're not going to give you the flexibility necessarily to attend a lecture or to miss a lecture, or maybe it's in person, it may not be asynchronous. So we highly discourage students from taking courses outside of the two we offer during the program, just because it can be quite challenging to do that. And if you are considering that, I would say, send me an email first so we can speak about it. Next question is about fluency of Spanish. What fluency of Spanish is required to participate in these programs? So we say intermediate level of Spanish. So that would be considered having completed Spanish level 3 at UCLA or the equivalent. So again, encourage you, if you have not completed Spanish level 3 or the equivalent and are a language learner, to do that as soon as possible, because we'd encourage you to do even more language if you can before the program begins. The next question is, what would you say is manageable to do? Would you say it's manageable to do another UCLA affiliated summer course at the same time as the internship? So I guess I already answered that in the prior question. So I would encourage you to only stick with the courses offered that we offered during the program. You're free to reach out to me, schedule a meeting if you want to discuss taking other coursework. But generally we discourage it because it can be quite challenging. We aren't going to allow you to skip rotations to do a different course because they have a lecture at a certain time. And a lot of courses, are going to be synchronous learning. So it'd be very challenging to also be in a different time zone and, attend a specific class at a certain time. So generally our answer is no, but you can speak with us further if you have additional questions about that. The next question is, questions about Spanish before the interview, and I might throw this to you, Carolina, to kind of think of how Giovanna does these, but what should they study before the interview? Are they looking for speaking, grammar, vocab?
So I'm going to talk about the program more than the interview. The interview, it's more, the objective is to get to know you, get to know your interests, make sure that it's a good fit for the program, but it's not that they're going to be checking your grammar and making sure that your sentences are perfect. The success of the program for people that are learning Spanish comes from how open you are about engaging in conversations, even if the grammar is not perfect, but that you can express some simple sentences that you can understand, some simple sentences as well. That would be what we call like beginner level. So intermediate level would be that you can hold a conversation a little bit longer beyond just the basic information, right? So that you can answer questions to the doctors or nurses or health professionals in the clinics and so on. I saw the question about if what happens if the Spanish is not good enough. You have time. You have time to practice right now. There's different ways of how you can improve your Spanish in different classes. And you're going to also have classes in country. So it hasn't been a problem with UCLA students at all that we have had like to turn down a student because of the Spanish level. So I don't anticipate that being an issue. Like I said, the most important thing is being comfortable, being in a space where you might not understand 100% of the language, but most importantly, being curious and with the intention and motivation to learn the language.
And another question about the language is, what is the community college equivalent to the UCLA Spanish 3 course? I don't know that exactly, but on the Spanish department, Spanish and Portuguese, the Department of Spanish and Portuguese at UCLA, they do have a Spanish language placement exam you can take to kind of gauge your Spanish language skills. If you transferred in Spanish credit from a community college, it should, and you transfer it to UCLA and they accepted it, it should tell you what, I believe, what classes that it is fulfilling. But if you're looking just to kind of gauge your language level, there is a placement exam provided by the Spanish and Portuguese department on campus. If you can't find it on their website, send me an email. You can see it on the screen here, and I'm happy to send it along to you just for you to gauge how you are, your skills beforehand. Another question is, does the program specify any Spanish major or minor requirements at UCLA? It does not, because the Spanish class, again, is not for credit. It's more just for practice. So you're not doing specific, like homework that you're getting graded. It, again, is just more to assist you both in terms of living your day-to-day life in the location, but also more specifically focused on, medical Spanish that you might be using in clinical rotations. Specifically, obviously, in Southern California, too, a lot of Spanish is used in the health sector. And so also being able to assist you when you come back here to California, being able to also have that language, have those skills to, work in such a setting. So. I see a question in the Q&A, but I think we answered it in terms of language proficiency already. Any other questions? These have all been really great. How many students are involved in the program? So in each location, there'll be a different amount. We're expecting approximately 15 in La Paz and maybe more, around 8 or so in Oaxaca, depending on our capacity. So every location's capacity, it varies depending on the interest and also what's possible at CFHI. So what's possible on the ground in both locations. So I don't want that to be a deterrent, though, for students who want to go to a particular location. Again, apply to the location that you're most interested in. We encourage you, to express why you're in that particular location during your advising call, as well as your statement of purpose. What is the homestay experience like? I'm gonna throw that to Carolina.
Yes, great question, Frida. Thank you for that. So you receive information before departure about the family that you're going to be staying, like name, address, who lives in the house, and things like that. So you can prepare in advance. The homestay tends to be actually one of the students' favorite part of the experience in some locations, because you live with the family and just being part of the routine, share some meals. Of course, each experience is different, as every family and every house is so different. But like I said, it's a great place for you to learn more about the culture, also show your culture as well, and practice your Spanish. So students, depending on the local reality that month that you're traveling, you might be host with other students at the same house, but you're all gonna have individual beds. So you might share room, but not beds. The bathrooms are usually shared, and there's also a section in our application when you can put any preferences that you might like. If you were traveling with a friend and you definitely want to be housed with that friend, that is something that we can do our best to accommodate. Or if you are allergic to dogs or cats, those are things that we need to know in advance also to plan your your program. And how you engage with the family, it's completely up to you. We have had students that become part of the family, and every time they go back, they visit their family, and others that have a little bit more distant relationship. But I'll say that this homestays have been working with CFHI for many, many years, and have been receiving students and have a lot of experience in this process.
And then we have another question. I'll throw back the slide, but I might give this to Carolina, is about the difference between the Bolivia and Mexico programs in terms of what to expect maybe in the internship sites, the experiences. So let me go back to that slide and then let you reiterate kind of the main differences.
So before going to the clinical setting, there's big differences about just the city where it's placed, right? So if you're trying to decide which one, I advise you to do a little bit of research about Oaxaca, a small city in south part of Mexico. La Paz, a bigger, more urban setting. Well, Oaxaca is also urban, but really a big city, like a lot of people, a lot of movement, very dynamic in that sense. In terms of the clinical rotations, if you're someone that is interested in pediatrics population, I advise that you choose La Paz. La Paz has rotations in a children's hospital. Then if you're someone that is interested in primary healthcare, both sites offer this, but there's more options in Oaxaca, more clinics that you are able to rotate. If you're interested in NGO work and NGO work in the global health field, La Paz would be a better fit. So the other things about like what the experience will look like, the daily day basis is really similar because both share that you're going to be shadowing the doctors at the clinics and that you're going to get to see different tiers of service within the country. So I don't know if that helped. It's actually one of those sites that is pretty similar in terms of some of the opportunities. The main difference would be pediatrics and maternal health is stronger in La Paz. Oaxaca is a little bit more general and broad, some of the rotations available. And you're, of course, welcome to express this during your application process.
And then I was just going to add that in both cases, the students stay quite close. So even though you may be at different homestay families, even though La Paz is a bigger city, you're actually all in the same neighborhood, walkable from one another. And even getting around, as Carolina was saying, with the teleférico is very easy. And I think the students who come back are always amazed compared to LA, how efficient and clean the system is compared to our metro here. And then Oaxaca, obviously, a smaller city, so more taking correct buses, correct, Carolina, and probably shorter distances to locations.
Yes. Yeah, buses would be the preferred method of transportation in Oaxaca.
And the next question is, how much time after we submit the application / interview will we be informed of our application status? So there's two main steps in the application submission process. So you'll first submit your application. We'll review it on our end. We always say about 5 business days. Really depends on when you apply, of how soon the turnaround is for us to review your application. As I mentioned, if you apply right before the November 27th deadline, we have a lot of students that apply at the same time, so it can take a little longer. If you apply, next week or something, usually in the middle of the application, students are more trickling in one by one, and we can review it hopefully quicker. Then we send you to do the advising interview with CFHI. That usually gets set up quite soon. So Juliana from CFHI will connect with you, send you a schedule invite so you can schedule a time. And that could happen maybe within a week or so once she contacts you. And then the actual acceptance notification of whether you've been accepted into the program will occur in the middle of January. And so I think the really important thing to note is there's no financial commitment. upon applying or conducting the advising interview. Only once you've been offered a place in the program, or is there a financial commitment? So upon being offered a place in the program, there's a $300 deposit. And then again, that'd be in the middle of January. And then in the middle of February is either when the final program fee is due, which includes tuition, housing, health insurance, all of the site support from CFHI, or your financial aid application. So one or the other. And that lets us know that you've finalized your place on the program. And then CFHI begins to work with you from there to help you in the pre-departure materials, as well as, getting your preferences for clinical settings. Usually the clinical settings, you don't learn your final schedule until either right before you arrive or when you arrive. But again, they take in some of those preferences. I do like to mention that you will be getting a variety of experience. So it won't be just if you like maternal health, you'll just be at maternal health the whole time. They want to give you a variety of experiences, but they do take into consideration some of your preferences so they can make sure they can cater your experience more towards what you're hoping to get out of the program. Any other questions? I'm gonna throw up the last slide again, and I'll put my email in the chat in case you do have any follow-up questions that happen after this info session. We will be posting this recording to the web pages, the overview page, if you do want to watch again afterwards. Another question in the chat is, just to clarify, there's no visa requirement for the Oaxaca site. If you are a U.S. passport holder, there is no visa requirement. If you have a different passport, please let us know, and then we can check to see whether there would be a visa requirement. For U.S. passport holders, there's no visa required. And to reiterate, for the Bolivia program, it's not a really strenuous process. There is some documentation you have to go through, but it's not a visa where you need to apply 4 months in advance or anything like that. So it does provide a little bit more flexibility. Once you're accepted into the program, then we'll begin giving you more information about the visa, but it's not a really tenuous process to go through. Any last questions? Well, if not, thank you all so much for attending. Again, we really hope to see your applications. If you're interested, encourage you to apply early so that you can get the advising interview done as soon as possible. And, again, excited to have another group of UCLA students abroad this summer. We did have an ambassador from this past summer, specifically in La Paz, Kindersley, who would be happy to connect with you as well. So when you are on our UCLA Global Internship website, you'll see student ambassadors, and we can assist you in connecting with her about her experience on the program. Other than that, thank you so much, and we hope to hear from you soon.